Thank you for attending this breakout session. This session is filled with powerful information to help improve your health and empower you. Radio Free 102.3 KJLH. We are you.
Hello, ladies. Thank you for joining me for this powerful panel. I'm so excited. So today, to frame the discussion, I really wanted to discuss what racism is. And according to the definition, racism is a system of structuring opportunity and assigning value based on social interpretation of how one looks, which is called race, and unfairly disadvantages some individuals and communities, unfairly advantages other individuals and other communities, and saps the strength and the whole society through the waste of human resources. We all know that to be true as African-American women who are charting our paths in the work. So I wanted to start there and to really put a question to you all, because today we're going to discuss topics under the rubric of racism is a public health issue, to include voting, poor medical treatment, advocacy, and homelessness. I want to shoot a question to you all as the number of state or local governments that have passed or are considering passing declarations of racism as a public health issue, public health crisis. Do you think this will be helpful? And we'll start up top with you, Ruthie.
Sure. So in terms of housing and homelessness, racism is in fact a public health disaster, particularly in major cities like LA, San Francisco, and Miami, where you see a disproportionate number of Black people facing displacement and homelessness. It's not only an issue, it's a disaster. It's something affecting lives daily. With millions of people facing homelessness, and with the COVID-19 pandemic facing further housing insecurity, and as far as COVID is concerned, the only thing that we were told so far that can keep us safe is shelter. And well, if you have no shelter, if your housing is fragile, that is a direct attack on your health. So I see racism and the system of racism as not just a public health issue, but a public health disaster.
Thank you. Dr. Wilson, would you like to chime in here?
Sure. I agree with Ruthie in regards to the homeless aspect of it. When we talk about socioeconomic status for African Americans, we are the ones that are highest in most of the health, and I can say epidemics or health problems that exist in our community today, whether it be HIV/AIDS, whether it's high blood pressure, diabetes, and now here with the COVID-19 pandemic. And so a lot of the socioeconomic issues that affect our community, homelessness being one, drugs, educational level, and jobs has been affecting that and can affect it along the long run. Also access to healthcare.
Thank you. Lauren, please join the conversation.
Yeah, I absolutely agree with Ruthie and Dr. Wilson. I think sometimes when people think of public health, they may just think about, actual health care. But in my mind, when we say public health and being a crisis, it encompasses everything. It's mental health, it's physical health, it's just overall access to care, like Dr. Wilson said. So because I feel like the African community or the Black community is always at a disadvantage in all three of those arenas, that's why it's a crisis for us, because there's so many stats and just disadvantages that we are always encountering. And due to that, it's absolutely a crisis that we're constantly trying to combat.
Yes. And Tanya?
Yes, so actually, I'm fortunate enough to live in a state where I reside in Ohio, and so we actually did declare racism as a public health crisis. And one of the reasons why is because there's so many food deserts here. Lead paint issue is really high in Ohio. Transportation issues. So declaring as a racism as a public health crisis, hopefully it will shed light and be able to bring more the necessary funding that we need in to address this longstanding issue.
Thank you. Thank you. So we are going to discussion today, ladies. Thank you for that with voting. Here's what we know. Data compiled and reported by the Atlantic magazine shows that 9% of Black respondents indicate that in the last election, they or someone in their household were told that they lacked proper identification to vote. However, just 3% of whites find themselves in a similar situation. With the challenges that we know are coming our way and already starting to happen as voter suppression becomes a major thing that we're going to have to contend with to make sure that people that can vote safely because of COVID, but also can exercise their right. I would like to throw this out to ask the question, do you think that democracy is at risk in November's vote? And so forgive me, I didn't know who was handling voting.
I'll take it.
Okay, thank you.
So I definitely think that the democracy is in jeopardy when it comes to voting. We see so many instances of already what's happening in the voting process, like you said, with voter suppression. You know, we could look at what happened in Georgia, Wisconsin. It's running rampant at this point, and we haven't even gotten to November yet. So I think we should really pay attention to these instances as to what the trajectory could possibly look like. You know, doing some research and doing some studies, it's really interesting to see that people are projecting that minorities are going to be the biggest ones to turn out in this election, which is so great to hear. You know, we see the stats are showing like about 32 million Hispanic voters are coming out, 30 million, you know, Black folks are coming out to vote. So I think overall, understanding the power in voting and that we actually do have power, I think it's been ingrained in our brains or just maybe in our history that we as Black people, you know, we don't need to vote, our votes don't matter, and that couldn't be further from the truth. You know, who we vote into office is really who create our democracy, and if we don't exercise that right, our democracy is always going to be in jeopardy.
Dr. Wilson, I know very fearful in light of what's going on with COVID, but conversely, I know that a lot of folks, especially Black folks, they want to go put their ballot, they want to stick their ballot in the box. You know, they don't like this, I'm gonna take it and put it in the mailbox because that don't feel like I really cast my vote. So what risks there are with folks voting, if they are going to vote, what do you advise them to do to make sure that they keep themselves, if they're going to keep themselves safe, if they're going to vote in person?
Okay, so great question. I do want to go back to when they were doing some voting back in Wisconsin. I am here in Illinois, and I know a lot of people may have become a little fearful of voting process because a lot of people had been exposed to COVID in Wisconsin, which is right next to us, during the voting session. So one thing to do is the same thing that they have been saying, and most states have mandated, is mask. One thing that I think a lot of people are not doing is that if we are not using the actual medical surgical mask and you're using like a homemade mask or a cloth mask, to make sure that you're washing that on a regular basis or changing it out. So that's one thing that's very, very important. Another thing is, you know, people tend to wear gloves, okay? So in my opinion, I think it's just better to wash your hands versus wearing the gloves, because people get in the habit of wearing the gloves and then you're still doing some cross-contamination, whether it be touching your face, touching, you know, things in your car, you know, so touching your cell phone. So making sure that if you do, you know, when you go in, sanitize your hands. I believe the last time that I actually went to vote, they did have hand sanitizer there. So make sure you sanitize your hands, you know, upon going into the booth. And then once you come out, sanitize your hands, and then prevent yourself from touching your face or anything, or rubbing your eyes, or, you know, touching your hair, doing anything that touches anything on your body outside of, like, you know, the steering wheel or the car door, or however you're getting back and forth to the polls. And just make sure that once you get home, you wash your hands.
Good advice. Good advice. Lauren, can you also, one of the things that we know to be true is the millennial generation, y'all ain't real jazzed up about this vote, and we know that. One of the things I'm most is y'all know that how important it is. Can you talk to us a little bit about what is voting looking like your generation?
Yeah, so I've been, just doing some research, and it's interesting because there's some discrepancy on age range and generation and who goes kind of with who. But saying all that to say, the Gen Y and the Gen Z generation actually, some stats came out that in actually the 2018 midterm election that we turned out in waves, in large waves. It was somewhere between, we actually outvoted the baby boomers by about almost 2 million votes in the midterm election. So they're actually saying that this could also be kind of, some foreshadowing for what could happen with the 2020 midterm election. 1 in 10, Gen Z voters have eligibility to actually go out and vote. So that's about 10% of the whole population are Gen Z voters, or can be Gen Z voters. Whether or not they actually go out and exercise that right to vote, we shall see. But it's looking like, although we're not gonna make up for most of the electorate as of yet, we're gonna be turning out in large waves to really exercise our rights to vote and make a difference in this 2020 election.
Tracy, can I add to what Lauren said?
Mm-hmm.
With the millennials, I think it's very interesting how when one of the rallies was taking place, I can't remember exactly what city or state that was in that Trump had, and and it came afterwards that a lot of the millennials had, reserved seats and things of that nature. And so because of their tech savvy ways and things that they know how to do, and they use social media and the way that they connect through social media, and I mean they put stuff out there and it spreads so quickly like wildfire. I really think that is what is very impactful with that generation in regards to the election, because it takes one person, they do the TikToks and all this different stuff and whatever they do to buy tickets, and so I think that's awesome because they think outside of the box. And I think with now, with everything that's going on, the Black Lives Movement and COVID, that they're really stepping up to the plate.
Yes, I agree. And if my son contributed, I think he bought a few tickets under somebody else's name, bless his heart. I want to come back to voting, but to talk a little bit about advocacy, Tanya. We know the trauma of violence in a person's personal life and the course of it is associated with stress. The comorbidities, lower life expectancy, all which bear extensive care and economic burden on our health systems while sapping the strength affecting a lot of our families and communities. I know in a lot of the work that you do, you kind of combine all work to make sure that you're doing the TikToks, as Dr. Wilson says, to kind of move some things forward. I wanted to ask you specifically, because this is one of the things that I think is gaining momentum, but now we're starting to see some backlash around. What do you think about the defund the police movement, and how do you think that may negatively impact, if you will, what's going on with the BLM, Black Lives Matter movement?
Sure. Well, I think first we need to understand that there's a difference between defund, deband, and reform. And I think people have been using those words interchangeably. So what we're proposing for the defund movement is not to actually eradicate the police altogether, but rather to reallocate those funds to other areas such as mental health and homelessness, in terms of getting more social workers on board. So there was a study that showed that police respond to calls pertaining to mental health and homelessness about 21% of the time, and they're not equipped to do that. So their automatic trigger is to either arrest or use a negative type of force. So rather than keep on doing that, we need more social workers who are equipped to do those things. So when we say defund, we don't mean eradicate the police, but to reallocate those funds to where they need to be.
Thank you for that. Thank you for that clarity. I know that your agency has been involved pretty extensively in a couple of movements, to include the Mississippi flag takedown and then the hail in Georgia. I would really like if you, Latonya, and you, Lauren, can talk about the issue from the advocacy standpoint and how that actually gets marketed so that you can get people involved. Lauren, we'll start with you, Tanya.
Okay, so AHF had launched the One Flag for All campaign back in, I believe it was 2015, to get the Mississippi flags taken down. They partner up with the NAACP, Black Bikers, the Black Church down there, and really started protesting. Unfortunately, it didn't pass back in 2015, but in light of the recent murders of, George Floyd, Ahmaud Arbery, and Breonna Taylor, AHF took a stab at it again. And so we started doing our Twitter protest rallies. We sent direct letters to the Mississippi legislators. We called them, we flooded their offices with phone calls to really hone in that this is wrong. Like the flag needs to be taken down. And so this time we were successful in doing that.
Absolutely. Yeah. Thank you.
And Tanya kind of touched on some of those marketing ideas or executions that we use to really get people involved. So like she said, we did Twitter rallies. We definitely always have updates on our website of how you can phone into your senator or congressman to get them to take action now. We've done things such as protests, which are more grassroots for us, whether it's going in front of a building and, chanting and annoying the heck out of people in office until they actually, make some change. So it's a variety of tactics. It's whatever we think, is needed for the situation or campaign at hand. But those are kind of some of those marketing elements that we use to make sure that we see some of these campaigns come to fruition and we ultimately win.
I know that we also use those tactics of our work around housing. Ruthie, can you speak to that a little?
Sure. We have employed virtual activism in light of COVID-19. It's really hard to expect people to be out at rallies and doing the things that we typically will do in person. And we've really capitalized on the opportunities afforded to us as having the internet and being able to do things like this, whether it's Zoom activism or Twitter, social media activism has really been a part of how we share the message about Proposition 21, which is a November 2020 election ballot measure that will call for limiting rent increases and preserving affordable housing. And again, to refer back to what I said in the beginning of our conversation, housing is at the intersection of everything. It affects all of us, and it touches us in all ways. So even if we're not the ones facing housing insecurity, displacement, or homelessness, we all feel the ramifications and the consequences of our neighbors and friends either being displaced or made homeless, whether it's increases in our taxes. I don't like to see people living in encampments. I live in an area of LA where when I first moved here a couple of years ago, you didn't see that, and you see that more and more. I don't like seeing people living in tents. California gets really hot. I've never felt this sort of heat in my life. And so the thought of having people living out there during this extreme heat that we feel in the summer and throughout the year, but especially during during a pandemic is really heartbreaking. So it's not just an issue that touches, the person facing homelessness, but it affects all of us. So hopefully we're able to use our activism and use our social media activism and our virtual activism in light of COVID to encourage people to turn out to vote. And to not only, it's more than democracy, to harken back to the question you asked earlier, it's not just our democracy that's at risk. I think democracy is always at risk. I think democracy is something that's very fragile, and it only works when the voters are able to participate fairly and they're educated enough on the issues to make the right choices. And so that's our job, to educate people and to also encourage people to turn out to vote.
Absolutely, that they understand that, right? So I'd like to pivot a little to Diane to discuss some of the work that your agency has done around high drug prices. first of all, why is that important in communities of color that we really need to work on getting things like Medicare for all and reductions in high drug that affect specifically women and their down their communities of color?
With the organization that I work for, we provide HIV meds to patients without health care, regardless of the ability to pay. However, if I do have patients who, let's just say, have high blood pressure, diabetes, a lot of times, or even mental health, because in the population that I serve, mental health is one of the main problems that I have to also deal with outside of their HIV. Those medications aren't necessarily covered. And let's just say somebody during COVID time has lost their insurance and they were on one of the psychiatric medications for bipolar, something that you see on TV. So those medications sometimes can cost up to like $1,000 just for a 30-day supply. So we're saying in order to keep someone's mental health intact, you know, especially during these high stressful times, then we're going to turn around and say, okay, well, we have to change your medication. But, you know, you have to also think about the fact that they have maybe been on multiple medications in the past, and this is the only thing that's working. So trying to find coverage for something that, you know, typically we know that it's not going to be covered. Let's also just take diabetes medication, insulin. I mean, you wouldn't think that something, and insulin is dependent for people. So we could also say, yes, I may, you know, be a little quote unquote crazy, or my mood may be off if I don't take my medication for my depression or my bipolar, but I could actually die, you know, or go into a diabetic coma if I don't have my insulin. And once again, that's something for a 30-day supply that we're charging well, not that we are, but that the drug companies are charging $1,000 for. And if we just talk about the HIV meds and hepatitis C meds, these are tens of thousands of dollars just for a 30-day supply. So, you know, I can just even speak for my own mother with her healthcare and diabetes. I mean, she has private insurance also to the age now where she has Medicare. And her copay just for a month's supply of her diabetes medication is $400, $500. So when we are talking about a population or a group of people who have to make a decision over whether or not I'm going to feed myself, feed my kids, pay my rent, you know, have a way to get back and forth to my job that is going to keep a roof over my head, I mean, you know, that ends up becoming on the back burner. So being able to have any type of healthcare that's going to cover that is very, very important.
Thank you. You know, it's one of those things we say all the time: when the rest of the world catches a cold, Black people catch pneumonia. And it really is evident in our conversation today. I wanted to pivot to talk about homelessness and one of the programs that your agency, Ruthie, is running. But to shape this conversation, per the National Alliance to End Homelessness, most minority groups in the U.S. experience homelessness at a higher rate than whites. Therefore, they make up a disproportionate share of the homeless population. African Americans make up more than 40% of homeless population, but represent 13% of the general population. That number has increased in years, and even at the rate of homelessness for other ethnicities has gone down. One of the things I always think about when homeless people, and we see it more and more, is women with babies. You got people, you know, and the vulnerability of women in general, and then the vulnerability of you having to leave the shelter with a child. All of these issues tend to be wrapped around poverty, incarceration, and mental health treatment that drive some of those homeless figures. Can you talk a little bit about, Ruthie, what is the biggest challenge you face in housing women specifically that are homeless?
Sure, absolutely. So I think you touched on it accurately a lot of times, and I think I've been guilty of this. I'm sure all of us today have been guilty of this. When we hear the term homelessness, or we think of the homeless, we tend to think of the people that I mentioned earlier, you know, living in encampments or living in tents. However, there's a large portion of the homeless population, particularly in the state of California, that live in their cars or move from motels to motels, or they're different demographics that we wouldn't necessarily think of. So we think of someone that perhaps suffers from mental illness or drug abuse, but we don't think of families. They're actually kids, whether they are newly emancipated from the state as far as being aging out, if you will, out of the foster care system and kind of being left to fend for themselves, or we have kids in college that aren't able to afford housing on campus and live in their cars. For me, that is something personal that I completely understand when I put myself through college back east. So couch surfing was a part of my game. And also, you know, not really having enough to live on campus and having to live off campus and find apartments when you're 17, 18 and have to deal with real life issues like this. It can sort of distract from your education. As far as women in particular, Black women in particular, you know, we find there's always been a history of racism in the American housing system, you know, from Jim Crow to redlining, where Black people couldn't live in certain neighborhoods, to the development of the ghettos and the public housing projects that we see so many Black people living in majority of the cities, to gentrification, which is something that we're facing now. On one hand, you hear the term gentrification, and for some people, it's a good thing because it's cleaning up the cities, right? Ironically, it's the same cities and ghettos that were created out of the same racist housing practices of the past and were then ignored by local governments for so long that are now being cleaned up. And with this cleaning up comes displacement, which is the ugly side of gentrification. It's really the displacement and forced homelessness of families. We already know that there's a large portion of Black women that are single moms. And so a lot of Black women who are single moms live in these housing project developments, if you will. And those are the families we're seeing displaced and facing homelessness more and more. There was just a study, for instance, that came out, the LA housing count for 2020, that happened before the COVID-19 pandemic. So the count happened from the end of last year to about January, February of this year. And we've seen an increase in homelessness. And with the Los Angeles Homeless Services Authority housing count, this is what they said. They said in 2020, we see they listed systematic racism as being the catalyst for increased homelessness amongst Black people. And it's disproportionate, where a number of Black people becoming homeless in LA County, where 8% of the overall population are Black people. You saw 34% of the people that are homeless represented amongst the Black community. So in a state,
in that regard, that's one of the things I'd like to pick up on, because I think that this need to look across all of the disparities of health that relate specifically to women. I'd really like for everyone to weigh in on the issue of, and you can use personal experience, what it's like to be a Black woman seeking care within these medical facilities, right? Because what tends to happen, we all know that's true, is sometimes we not believed, right? So I want to talk about the issue of why there's a difference for the treatment from medical systems, Dr. Wilson, and for the team for Black women. Can we start on the bottom with Lauren and Tanya? Tell us what your thoughts are about why this is such a systemic problem and why it contributes to race. We'll end up with you, Dr. Wilson. Lauren, I'm sorry.
Okay. Yeah, I mean, personal experience, I have to say that I'm very grateful that I've always had a female doctor, whether it was, you know, starting out as my pediatrician. She wasn't African-American, she was a white doctor, but she related to like my background and kind of my upbringing. So I've always been very grateful in that aspect to have had a female doctor who kind of just took more and paid more attention to, you know, myself, my health, what was going on with me. But to your point, Tracy, I think it goes back to history. You know, Black women have always been viewed as, we're just stronger, you know, we have to be the strongest in all aspects, you know, we take pain very well. you know, but at the same time, you know, we're angry, and we get listed with all of these stereotypes that end up, you know, making us, you know, the most disrespected, you know, group of people in the world today. So it's an unfortunate narrative that we have to always deal with, and because of that, it causes our health to be compromised. But I think that it's important that we actually start speaking up. You know, like Dr. Wilson said, everybody doesn't have access to great healthcare. You know, my OBGYN is a Black female doctor. I'm so grateful for it. Everybody doesn't have those same opportunities to have that type of healthcare where you can have those open and transparent and candid conversations about your health and what you're experiencing, and getting that advice or guidance from somebody who looks like you and has those same experiences. So yeah, from a personal perspective, those would be my thoughts.
Tanya?
So it's interesting that you say that. So my mom is actually battling cancer right now. And so I have to oftentimes advocate for her because my mom is older. So she is from that generation where I'm just going to listen to the doctor. And even if they ask me something, you just go along with it. But it's like, you know, I'm being younger, and it's like, no, you speak up. Like she's experiencing this symptom. But, you know, when she gets into those appointments, she doesn't want to speak because, of course, the doctor, they know everything. So I'm just going to sit here, and whatever they say, I'm going to go with, I'm going to take. So I always have to make sure I'm with her at every appointment so I can speak up for her.
Absolutely. Ruthie, did you want to weigh in on this one?
Sure, and I actually have a personal experience with this. My OBGYN currently is a Black woman, but back east, it was a white man. I had gotten an IUD that I realized was making me sick. And I knew that's the only thing that had changed. And it was the only thing that was making me sick continuously. And I would go to him, and every visit, because I would always get sick, I would go to him and tell him, I believe this is what's causing my illness. And he didn't believe me. And he would give me antibiotics and send me on my way. And again, I'll get sick and I'll come back. And it took me bleeding, getting really, really, really sick for him to finally listen to me, and me demanding that he removes it immediately. He removed the IUD, and I broke out. I'm not a person that's allergic to many things. I'm lactose intolerant, but that's about it. I broke out in hives everywhere. So later on, we found out that this thing was really, it was almost poisoning me from the inside. It was embedded in a way how he inserted it. It was wrong, and it got embedded into my cervix, into my wall, and was causing infection and making me really, really sick. So even the act of removing it accelerated the infection that was already happening. And I remember, you know, at the time I was working for a public affairs company, and my boss, a white woman, freaked out and just had, you know, she was the one to say, okay, we're going to call up and really like tell this, like, yes, he removed it, but had he listened to you, this wouldn't have happened. And that for me is what really changed the way I treat my health and interacting with doctors, watching this white woman who had no qualms and no reservations as far as speaking up, and even calling the doctor after this, he'd already removed the IUD, and calling him out is what taught me that we too should speak up and call out doctors and pay attention to our own health. We know our bodies, and we should listen to our bodies for sure.
Absolutely. So Dr. Wilson, help us out. I mean, what is it about Black women that we are, one, not believed, as the panel has said, but two, how do we be better advocates for our own health? Because we know that is part of the racism issue, is we don't feel like we can speak up. Please.
Well, I'm going to touch on something that each of the other ladies on the panel mentioned. First off, like, personal stories with Tanya, and I mentioned my mother before, so she has diabetes, so I really, really think that she needs another endocrinologist. Okay, she's had episodes where she's passed out. I think she's on too much insulin. I know my mom, she's hard-headed. She wants to do things her way. I've been diabetic since I'm 20. You're not going to tell me I'm going to eat what I want to eat. Okay, so, you know, I try to go to the doctor's appointments. I mean, she gets livid. So, I mean, it's to the point where I had said to her, I said, I really think that you should just try to get a second opinion. I even talked to her primary care, her internal. I'm like, I really think you need to encourage her to get a second opinion. Now, her internal medicine doctor is a Black African-American male, and the endocrinologist is a white male. Oh goodness, you would have thought that my mother was married to this man. She got so upset at me because I said, if you die from a diabetic coma, I'm going to sue him. No, you're not. I'm like, you wouldn't know because you'll be dead. But I meant that to say to her, like, you need to ask why am I still having these side effects from my medication? I shouldn't be passing out. I wasn't doing this before. What's going on? And just like Ruthie said, people know their bodies. We call doctors out, and I said to her, I tell my patients all the time, I'm not always right. Sometimes I don't know the answers, and that's fine to not know the answers. But, you have to be able to listen to the patient, because I can tell a patient everything they want to know, or everything I think they want to know. If you don't buy into what I'm saying or believe what I'm saying, you're going to go home and do exactly what you want to do, regardless of what I say. So one thing that I tell all of my patients is to make sure that you understand what a doctor is saying to you. Ask questions. Don't go in just, I'm the doctor, I know what I'm talking about. It's fine if you ask questions. I want my patients to ask questions, because I always say, any questions before I leave? If they don't ask questions, I'm assuming they understand. And I tell all of my patients, I'm telling you this so if you never see me again, you can understand what this lab means, what this means. And if you don't understand, your job is to make the doctor explain it to you in a way that you do understand. If they're short, they don't want to explain it, you demand. That's what they're there for. They're there to make sure that you understand. I tell all my patients, oh, I'm taking a medication. What are you taking it for? I don't know. They just told me to take it. So why are we taking it? You need to know why you're taking it, what you're taking it for. I don't want to just, and I'm not a doctor who just throws out pills, but I don't want patients just to take something because I said so. Because you're more compliant and you're more likely to be adherent to your medication if you understand why. Like I said, it's just like anything else. We have to buy into what we're doing. So that's one thing. So I like to make sure that I educate. And so that's one thing that we need to do. We need to make sure that your doctor is educating you. It's a partnership. It's not like I say and then you do. It's a give and take. Just like Ruthie said, I could be wrong, but at the end of the day, it's her body. So you want to do it your way, we can go ahead and do it your way. If your way fails, then we can come back to my way. So that's one thing. In regards to the pain aspect, it goes back to exactly what Lauren said. As women, as African-American women, the thought is that we're strong. We take care of everybody else. A lot of times we put ourselves last. We'll take care of mothers, husbands, brothers, partners, everybody else, and we come last. And so I always tell people, you can't take care of somebody else if you don't take care of yourself first. And then just looking up some information in regards to the whole pain aspect, that starts with med school, okay? Because that's where the doctors are trained. That's where they get their information, they obtain their information. And even though someone is a doctor, it doesn't put them past having their biases or their thought process in regards to stereotypes. So there was an article in the Association of American Medical Colleges back in January of 2020 that brought about the myths of African Americans, not just women, but just African Americans in general, as it relates to pain. And so one of the myths is that we have thicker skin. Okay. And so part of that is just our persona of how we're perceived, that we can take on anything. And that also that our nerve endings are less sensitive to pain than our white counterparts. And so when they took a survey of medical students, the first and second year medical students, 40% of them thought that those myths were accurate. So, so that's where we have to start retraining people and rethinking about, letting individuals know. But once again, if we don't speak up and say anything, and we, sometimes we go in with this facade like, oh, I'm okay, I don't want, pain medicine, I'm good. And so we buy into these biases that we have, because a lot of doctors, and then I'm going to end with this, because a lot of doctors, like I said, have those stereotypes. One thing about me, the first job that I had coming out of residency, I was working with a lot of people who did not look like me. And that was not where I knew that I wanted to stay, because you want to be able to, well, I wanted to be able to work with the community in which I grew up in. So you want to be able to give back. And my way of giving back is making sure that I help my people. And it is a big difference when I just hear a lot of my patients are able to say that they can talk to me and relate to me because I'm Black. It doesn't matter whether they feel that my socioeconomic status or my education level is higher than them, but also just because they know that no matter what my socioeconomic status, whether I make money, I don't make money, whether they have a job or don't have a job, I went to college, they didn't go, they know that there's things that we are always going to relate to because we have the same skin color. So, you know, it's very rewarding for me to just be able to know that I can be that, because that friend or that confidant to a lot of people who have no one. And so just being, happens a lot, right? It happens a lot. And, you know, and in the Black community, when we just talk about pain and just,
in light of that, and this is one of the, I know we're wrapping up, but one of the things I really would like to pull Lauren and Tanya back in on is around how do we educate the community about all of the things that we discussed. In the age of COVID, in the age of internet, where everything, you got so much information coming at you, you know, in so many different ways, what's best? What are the things that, you know, in your expertise, Lauren, in your advocacy, Tanya, what's best? Is it radio? Is it print media? Is it internet? How are we reach the community? Because one of the things that, you know, not for nothing, everybody been Netflixing and chilling, that at some point they're gonna all show up to Dr. Wilson's clinic with a burn, right? So how do we reach the community to make sure that they understand risk, they understand what they need to do about the pandemic, they understand that they don't have to be on the street? How do we reach them?
So I think it's a combination of things, especially from a marketing standpoint, where you've been constantly trying to, you know, reevaluate, reassess what we can do to reach these people. There's just simple things like what we used to do to like put up a billboard. You know, people are driving everywhere, so they can see something, they can see a message, information, or see, you know, a URL to a website. That wasn't really happening. So we really realized that social media has been very helpful. While the internet, it's a great tool, but sometimes, you know, the internet can make you a little paranoid, bring you some anxiety. So I think it's a combination of balancing out those mediums to get your information, you know, but also talking to people, especially because of COVID. We don't have those interactions, those human-to-human contact interactions and those sort of things. We need to still be talking to people and having these conversations, because the internet's only going to tell you so much. You know, seeing messages on social media is only going to lend so much insight, but those conversations is actually where you see these ideas and these revelations really kind of come together and make sense for somebody. So that's always, well, not always, but that has become, I would say, my number one thing is finding my own ways to access the information, but then actually analyze it and figure out how it makes sense and how you want to apply it to yourself.
Yeah, I totally agree with Lauren. One of the biggest things we have been doing has been Twitter and getting the messages around. And so we have 28 mobilizers around the country who specialize in their communities and to educate about AHF and different resources. And so some of the things that they have been doing around the country is they have been social distancing, of course, but they still pass out resources with hand sanitizers and masks to let people know about the facts about COVID. They're still informing about, you know, the wellness, where they can go get tested for wellness, where they can go access their medications. So they're still doing the same work that we were doing prior to being a pandemic. They just have to be more mindful on how to do it. So they're using the social media. They're holding Zoom meetings. They're doing like the car drive-bys where people are just literally driving by in their car and they're handing them their information in the cars.
So this has been a really rich conversation, but I would be to end it without acknowledging that community is what binds us together, which you can see in this conversation we've had today. And in that community, I know a number of you young ladies are members of Nine. So just in a couple minutes as we wrap up, tell us about your sorority and what your sorority is doing to make sure that you are keeping the community informed in the age of the pandemic.
We'll go in founding order.
Oh. Okay, well, I am a proud member of Alpha Kappa Alpha Sorority Incorporated. And we have 5 targeted initiatives that are currently going on under our BAS list. But I will say the one that I find is probably the most important is economic legacy, especially during the time of COVID and, race relations, systemic racism, all of those things. Generational wealth is something that keeps coming up as something that we as Black people just are not afforded, and that's due to the history through Jim Crow, slavery, all of those different entities. So I would say that would be the most important target initiative in educating our people about that and how we can start that momentum going for ourselves, so that way we're not subjected to things like homelessness, miseducation, lack of access to care, all the things that we've really touched on.
Thank you. Who's next?
All right, so I am a member of Delta Sigma Theta Sorority Incorporated, and we have been working on, I know here in Chicago with the alumni chapter that I am affiliated with, making sure for voter registration that everybody is getting out and registered to vote, making sure they're understanding the importance of their vote, also working with the youth and making sure that they know how to interact with the police when they're stopped by the police, if something happens when they're hanging out with their friends prior to COVID, or how bad COVID has gotten now, making sure that they understand how to, do minor healthcare treatment if someone is shot in regards to like applying pressure, tying off wounds, things of that nature. And also just making sure, I think somebody mentioned earlier about Zoom calls, and just kind of getting those Zoom calls out to make people aware of what's going on and making people aware of how we need to be able to be supportive of each other in the situations that we're going through right now.
Thank you. And Tanya, we'll wrap with you.
Sure. I am a proud member of Zeta Phi Beta Sorority Incorporated. I want to say happy centennial to all of my sorors. I know we're in a pandemic, but it's still our centennial. Some of our focuses we have been doing, as well as the Deltas, is voter registration, definitely getting out the vote, and educating them on the importance to vote on every level, just not in the presidential election, but also on the local and the state as well, because that's where the real change first happens. Also, we've been doing work around the census, because we need everybody to understand how important it is to complete the 2020 census, because that's how you actually get resources into your direct communities. We've also been raising awareness around domestic violence, because of course, because of the pandemic, we have been seeing such an uprise in domestic violence because the women or whoever is being abused have nowhere to go. We've also been focusing on our youth, making sure they still stay engaged and building them to be future leaders.
Thank you so much, ladies. This has been an amazing conversation, and I thank you for allowing me to be a part. I've learned so much. We're gonna give our last comment to Miss Ruthie in our last minute. Tell us how you've been working. I know that you are not traditionally from America, so your family at least. Can you tell us about how it is that you brought community with you from your country to this one?
That's a great
and how we can learn.
Good question. So for me, I'm from the Caribbean. I'm from Dominica. I grew up in the Virgin Islands, St. Thomas to be specific. And St. Thomas is actually seeing a spike right now in the number of COVID cases because Americans who were able to fly with just your ID. So in case you guys want to go after the pandemic, they've been going during the pandemic and not really practicing the elements that we're trying to implement up here. They're going home and they're to St. Thomas and it's vacation. And so we're starting to see a rise not only in the number of infections, but also deaths. which is scary. But as far as how I've been coping, dealing, not only living in, I mentioned this before when we were doing our prep, but living in a state that has a very small, a state and city, a small population of Caribbean people, coming from somewhere that had a massive population. It's been difficult. I am by nature someone that loves to work, and sometimes have been guilty of hitting the ignore button because I want to finish the last email I'm working on. But this pandemic has actually forced me to slow down in many ways, and really connect with family members, and answer their FaceTime and answer their video chats, which I ignored in the past because just not being able, I always had the idea that I can always go home. And I actually travel home several times a year. It's just a norm for me. Having been blessed to work from home, I would work from anywhere. I was used to going home since moving to LA several times in the year. And that for me is just out of the question. But this pandemic, in a weird way, it's forced me to reconnect with family. It's forced me, you find yourself missing the things that you took for granted. And for me, for sure, family is something I definitely took for granted, and communicating with them. So this is definitely in a twisted way, helped me to reconnect with my people and reconnect with my loved ones. And that has been,
so much.
Yeah, for sure.
Thank you, ladies. Thank you.
We've got to take the fear out of this. And that's why AIDS Healthcare Foundation, that has a vision to bring us all together, beginning with the claim that healthcare is not a privilege, it is a right, it's a moral right, it's a human right, it's a civil right.
The KJLH 20th Annual Women's Health Expo at KJLHradio.com. Presented virtually by RastAfri and Radio Free. KJLH.